Namaskar friends, I am Dr. Anil Heroor. I am the head surgical oncology at Fortis Hospital, Mumbai. This is the Gynecological Cancer Awareness Month and indeed an ideal time to talk about this malignancy. What are gynecological cancers or cancers affecting women? We may think that these are only cancers of the uterus or of the ovary, but remember, breast cancer is the most common cancer affecting women today. Nearly 150,000 women and more are diagnosed with breast cancer every year in India. We are also the dubious distinction of being the third highest ovarian cancer country. So these cancers are a major chunk of our cancer population. Breast cancers have been on the increase in our country since the last 10 to 20 years, with the incidence almost doubling. Also, these women are 10 years or so younger than their Western counterparts. This is important because today, working women contribute a lot to the society. They are important for their families in order to bring about a very positive change in the society. When a woman gets affected, it is not only her, but the entire society that gets affected. And hence, these cancers and the age at which these are diagnosed are extremely important. As I was talking about breast cancer basically starts off with just a small lump in the breast. It is painless, it does not cause any problems, no fever, no redness, nothing at all. All that exists is a lump and hence is ignored by a lot of people, which is the most dangerous thing to do. Remember, a painless lump in the breast is the most dangerous lump. Get that diagnosed. How do we diagnose it? We diagnose it by doing a clinical examination and by doing a test called mammography. I'm sure all of you know about mammography. Mammography is an X-ray of the breasts, and these can detect nearly 90% of breast lumps. Once that is done, we go ahead with a biopsy which proves or disproves the existence of cancer, and then further treatment is done. Treatments of breast cancer have evolved. Surgery has evolved from being a completely destructive surgery of removing the entire breast to breast conservation surgery, where the body image of a person is preserved as much as possible. Chemotherapy has improved. We have targeted chemotherapies. The side effects of chemotherapy have reduced because of excellent supportive care medications available. Radiation also today is much different than what it was about 50 years back. Back then, radiation used to cause hard, woody tissues. Now, with improved software, you can give targeted radiation. So all these changes are making treatment easier, and they are obviously resulting in not only giving good survival rates, but also good quality of life in those surviving years. Other cancer which is extremely common in India and over the world is cervical cancer. Now what is the cervix? The cervix is the mouth of the uterus. Cervical cancer is actually a very preventable cancer because it is caused by a virus. Now there are vaccines available in order to reduce the incidence of cervical cancer. These vaccines should be given to young girls between the age of 9 and 26 years. Cervical cancer basically has symptoms of bleeding, white discharge, foul-smelling discharge, and pain. The diagnosis of cervical cancer is also not very difficult, with just about a biopsy to be done and some imaging techniques like sonography or MRI. Treatment includes surgery and radiation along with chemotherapy. Cervical cancer is then now screened with the help of a screening test called as Pap smear. Have you heard of Pap smear? Pap smear is where you take some cells from the cervix or the mouth of the uterus and then see them on a slide. If they show any changes, then these cancers are picked up early. Pap smear should be done by all sexually active women at least once in 3 years till the age of 50 and then annually thereafter till the age of 65. So one question that is being asked by one of the viewers is that age playing a role in these malignancies. Does age play a role? So age does not directly play a role, but with advancing age, the incidence of cancers increase. The other thing is, it's something like this, you have a machine, you have a car. As it gets older, there are obviously problems that are going to happen in the car. So similarly, the human body ultimately is a machine. So as it ages, the problems obviously increase. The second thing is that each age has its own typical cancer. So there are certain cancers which occur in pediatric age groups, and there are certain cancers which are commoner in older age groups. But as a rule of the thumb, as age increases, cancer increases. Another interesting question is about lifestyle modifications if I am diagnosed with cancer. So the interesting part here is that you should actually have lifestyle modifications before you get cancer. Now how is that? Because obesity is one of the most important reasons of cancer. It is playing a role in breast cancer, it plays a role in ovarian cancer, it plays a role in large intestine or colonic cancers. So obesity is now a big part of, and physical activity is a big part of why cancer happens. And hence, if we have to do lifestyle modifications, they are best done before cancer strikes. So prevention is always better than cure, and hence you have to go easy on those fats, and you have to exercise well and keep generally a fit body so that cancer also does not get a chance to invade your body. Once cancer is diagnosed, obviously there are certain lifestyle modifications that happen during the course of treatment, because chemotherapy you can't eat out, you have to take care about what you are eating, no raw stuff, etc. That your doctors will guide you well. But once cancer is cured, you are a free bird. You can definitely follow whatever normal lifestyle you used to follow before that, and obviously it doesn't mean that you can go berserk on all those fats. Still pay attention to your body, maintain a fit. There's one interesting question from a lady who says that, will I be able to cope up with the cancer if I am over 55? People used to say that life begins at 40, now they say life begins at 60. So now basically age has nothing to do with it. It depends on the fitness of a person. If a person is fit, then he can tolerate any treatment at any age. Definitely, the oldest patient of breast cancer that I have treated has been 93-year-old's grandmother, and she was absolutely fit. The youngest is 21 years. So it's not about the chronological age, it is about the physiological age. How fit you are, what are the other comorbidities like diabetes, blood pressure, heart problems, what are the other things that the body has. All these go into decision making as far as tolerating treatment is concerned. So it's not an unidimensional thing, and chronological age has nothing to do with it. As they say, it's just a number. बस एवढेच क्वेश्चन
एंड करूया का?
So friends, thank you for joining us on this short segment on gynecological cancers or women's cancers. I really enjoyed interacting with you. Any further questions, just write to us, mail us. We'll be happy to revert back. Don't fear cancer. Diagnose it early. Remember, as we say in Marathi, वेळेत निदान देईल जीवदान.